Thank you for joining us today for our Veteran Oral Health Virtual Road Tour stop in North Dakota. We're thrilled to be here with all of you and have you with us. As you come in from the waiting room, I invite you to come on camera. This session is designed to be very interactive with several points for community discussion. So if you are able, we would love for you to be on camera and be ready to discuss. I am Liz Flannery. I'm the Director of Education here at AIDPH. And again, we're thrilled to get started and have you all with us here today and be visiting North Dakota. Okay, we're going to go ahead and get started. I am going to go over some housekeeping pieces and an introduction about AIDPH and why we're here today. We are going to look at a national overview of veteran oral health and then dive in deeper and look at the data in North Dakota and what is going on in your state. As I said, we designed these sessions to be very interactive. We have several different points for you to provide feedback and community discussion. So please get ready for that. We're excited to hear from you. And we'll of course close out with next steps. We are recording this session. Rahel, I'm pretty sure we heard record at the beginning, just checking. Okay, fantastic. I'm joined by Rahel Michael, my colleague at AIDPH. If you are having any issues with Zoom or questions, you can always direct message her on the chat. We will post these slides, the recording materials that are shared during this session on our Academy. That is also where you will be able to request your CEU for this session, and we'll share information about that at the end. If you're watching this asynchronously, you will have information on the Academy about how to get that CEU after you finish the recording. In addition to wanting this session to be designed to hear from you and gather feedback and your thoughts, we also want to provide space and time for you to connect with your colleagues in your state, fellow stakeholders who are working in oral health and veteran oral health. So we invite you to type your name, your organization, if you want to share your contact information in the chat to say hello and introduce yourself. And please feel free to connect with each other and share about the work that you're doing in the chat. Okay, so one of the ways that we're going to engage together today is using Slido. It is a fairly straightforward tool. You can access it in two ways. You can scan this QR code here. So if you have your phone and want to scan your QR code, I invite you to do so. Or you can go to slido.com, type in this code that we have down below, and it will pull up our session here today. We are going to use this at different points throughout our session. So once you pull it up, please keep it posted so you can engage each time. And we will come back to this in just a second. I think Rahel is also going to put the website and the code in the chat for us. Okay. These are our learning objectives for the session here today. I mentioned CEU. Those are available for free attached to this session. These learning objectives are tied to that CEU. They're available in the registration materials as well as on the Academy. So let's get warmed up with Slido, our interaction tool for today, one of our interaction tools. So if you toggle back over to that website, well, like I said, it's popped in the chat. And we would love to start off by hearing from you about what brought you to today's session. Did you come to learn, to share, connect, act, or perhaps all four of those? Okay. I'm seeing all of the above as our majority selection here. I love that. Learning. I hope you'll have to let me know at the end of the session if you feel like you're coming away learning something. Okay. All right. I'm going to toggle us back to our slides, but I see some folks are still participating in the poll. So please continue to do so, even though I go back to slides off of the screen here. You can still access Slido. Okay. I am your presenter for today's session, and I am sharing that I don't have any disclosures or conflict of interest to share. I introduced myself at the top of the call, but to reiterate, I'm the Director of Education and Leadership here at AIDPH. I'm joined by my colleague, Rahel Michael, who is our Organizational Administrator. And we want to take a moment and say a big thank you to Kimberly Kuhlman, who is the Policy and Partnership Manager at Community Healthcare Association of the Dakotas. Kim, we wouldn't be here without you. We had a really wonderful registration for this session here today, and that's all thanks to Kim and getting in touch with you local stakeholders. So thank you for hosting us, Kim, and all of the work that you've done to bring us here today. Okay. We are going to go back to Slido again. And before we get started, we want to know, what do you believe are the top priority areas for veteran oral health in your state? And that will really help me tailor our content here today as we go into our seminar and the data. So we have access to care, oral health literacy, workforce development. Also noting that if you did close your window, you can access Slido with this piece right here. Okay. Access to care is 100% so far. I always share out. We have visited more than half of the states in the country so far, and I don't think we've been on a single session where access to care hasn't been the first thing selected and the majority issue selected. Okay. I invite you, for those of you who have not yet had a chance to participate, please continue to respond to this poll, even though we are moving on to other slides. Okay, so we're going to get started and talk a little bit about AIDPH and why is AIDPH here doing this work? Who are we? Why are we delivering this seminar? We're a 501c3 nonprofit, and our mission is to empower our community to advance oral health through science, education, and advocacy. And hopefully, you see all three of those pieces intersecting today during our time. We do this work because we have a vision of a justice oriented oral health system. We have 4 communities of focus here at AIDPH that includes LGBTQIA plus people, veterans, which are obviously focusing on today, people with disabilities, and people living in rural communities. And we understand, of course, that there is intersectionality on these 4 communities of focus. For example, what we'll hear about today as we dive into the data and look at the landscape. Approximately 30% of veterans report having a disability. Approximately 25% of veterans live in a rural area, something that we'll talk about more in depth as we dive into the data. And all of our communities of focus have the common experience of historical exclusion and marginalization from healthcare systems. We want to take a quick minute and say thank you also to our funder. CareQuest Institute for Oral Health is funding this project and allowing us to be here today. And a quick look at our partnership with CareQuest on veteran oral health and some of the work that got us to where we're here today. Again, why are we delivering this seminar? Our work in veteran oral health research started in 2021. Annalise, our co-founder and executive director who led the start of that work, always shares out that she is the spouse of a veteran. And is loath to admit that when CareQuest came to her and said, "What do we know about veteran oral health?" She said, "I don't know." And when she dug a little deeper, realized that it could fit about half a page of what we really knew about veteran oral health. So that was our call to action, that we needed to look at the data and fill that gap. And since then, we have published several papers. We have conducted several research projects. That research and data has allowed us to put forward data-informed policy recommendations. We've been to several Hill Days. We actually had Federal Service Immersion Fellows in DC last week who were talking about veteran oral health and the way that we can support that at the federal level, as well as doing some state-based place work like we're doing here today. When we were talking about that national overview that I'm going to give some detail on in just a second, we were really hearing from states, what does veteran oral health look like in my state? That led us to developing out a profile in every state of the country, looking at that data in the state, and to these seminars here today. So we can talk to stakeholders like you, talk about these tools, have a community discussion, and also make sure that folks working on this understand that these data tools are here and talk about how you can leverage them to assist your work. Okay, so starting with the national overview, like I said, this might be familiar to some of you, but doing this work for many years now, we often find that many people don't understand the eligibility process, what care veterans can receive, or even where and how they can access that care. So that's why we like to begin by setting the stage with a clear picture of what's currently available through the VA and what veteran oral health looks like at the national level. So there's two key points I'm going to make across the next two slides. The first one here being is that eligibility for medical and dental care through the VA is not set by the VA itself. It's determined by Congress through a federal law called Title 38. And that law outlines what care is covered, who qualifies, how much it costs, and where it can be delivered. And because of that, any major change like expanding dental coverage requires congressional action at the federal level. It's not just a rule change or a policy update, it involves passing new legislation and securing federal funding to support it. For example, in the past few years, we've seen the PACT Act pass, which was very exciting. A lot of work went into that. Once the PACT Act passed, the amount of veterans who were eligible for dental care increased, not because it was part of part of that legislation, but the legislation made it so that more people were eligible for 100% disability, which impacted the amount of veterans that were eligible for dental care. So that's an example of how federal legislation can impact how many veterans can access dental care through the VA. So again, talking about the limitations in access to dental care for veterans through the VA, it ties back to that federal level. And at the same time, I want to point out that that doesn't mean we can't take action at the state level to impact change. We're going to go look at some examples of state-based work that has really increased access for those states. The first step is getting educated on the population need, which is what everyone here is doing here today. So thank you for being here with us. So the second point of the national overview and kind of really looking at access, I alluded to this. The second point here is that most veterans aren't eligible for dental care through the VA. The top row of people in this graphic that you see represents all 18 million veterans living in the US today. The lighter half over to the right shows veterans who either receive care outside the VA or aren't eligible for VA healthcare at all. As you moved left on the chart, the darker blue sections represent the nearly 9 million veterans enrolled in VA healthcare. But of those, only a tiny fraction, the small blue and red segment, is actually eligible for dental care through the VA. That's what I was alluding to with the PACT Act. So what this means is that veterans might be going to the VA for a medical appointment. They might be getting treatment for a chronic disease condition, but they're leaving still dealing with untreated dental needs and potentially even pain. Additionally, the other point that needs highlighting here is that even among the about 1.8 million veterans who are eligible for dental benefits, only about a third are actually using them. We need some more information to understand that utilization rate, but we suspect that barriers to care, we're going to look at some of those barriers, and lack of awareness play a big role with that utilization rate. So let's look a little more specifically at veteran oral health at the national level. We know that chronic disease is connected to oral health, and veterans living with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues. What's even more concerning here is that our research shows that veterans with these high risk, high cost conditions are more likely to lose all of their permanent teeth. And we see poor oral health outcomes for veterans than non-veterans, even when they've seen a dentist in the past year. So that tells us that access alone isn't solving the problem. Even when veterans are getting the dental care, still many are facing some of the worst oral health outcomes. And that really points to the need for integrated care. Those chronic conditions aren't being addressed in coordination with other health needs. And that's why the issue is really frustrating because the VA is the largest integrated healthcare system in the country. It's uniquely positioned to manage complex care for veterans with multiple chronic conditions. But since most veterans aren't eligible for dental care through the VA, they're missing out on that critical coordinated care piece. Let's look a little more closely. So this is coming from research that, again, we conducted in partnership with CareQuest that really focuses on the connection between chronic disease and oral health. So even for controlling for factors like income, education, whether someone lives in a rural area, we found that veterans with diabetes were still 40% more likely to be edentulous, meaning they've lost all of their natural teeth compared to veterans without diabetes. So again, really looking at that connection with chronic disease. Just as concerning are the findings that we see related to heart disease. Veterans with heart disease were 30% more likely to be completely edentulous compared to veterans without heart disease. Okay, I'm just seeing some folks in the waiting room, so I'm letting them in. Okay, let's look at this at a systems level. What we want to highlight here is that this isn't just about poor oral health outcomes or reduced quality of life. Of course, those are very serious concerns. It's also about the broader health impact and the cost of care. So when dental care is managed as part of an integrated healthcare system, again, what the VA could offer if dental coverage were expanded, there's a clear opportunity for cost savings, especially for veterans with chronic conditions. So some of our recent research shows that for every $1 invested in dental care as part of diabetes management, there's a $1 savings in related medical costs. And with heart disease, it's more striking. Every $1 spent on preventative oral health care can result in $2 saved in heart disease management. So at that point, dental care isn't just a health benefit, it's really paying for itself. So looking at these stats here, these are data points that were collected again during our research, many of which have come from BERFIS, which is a national survey of veterans administered in 2021, as well as data accessed through the VA, really showing some of those disparities that veterans face at the national level. We also always work to conduct our research in a mixed methods manner to really make that first person human connection to what the data we're looking at is, what that impact is. And we share this quote here because it really shows this comes from a working age veteran living in Maryland, unable to afford care. And you can see here that they're asking for help. They're in desperate need of support and help getting access to that care. Okay. So I don't believe I've mentioned the research that I just talked about, the research we're going to continue talking about through our session here today is all available on vetdentaldata.org, and Rahel can pop that into the chat for us. That has the state profiles we're looking at. It has all of our publications, but it has also several different interactive dashboards. So I just want to highlight some pieces of what you can do going to that website if you need to dial into your state more based on the work that you're doing and the data that you need. So this shows some interactive insights on rural veterans, cost of care, and state-based indicators that can be accessed on the website. We have an entire tab dedicated to rural veterans. I mentioned that at the beginning. We'll talk about rural veterans a fair amount because we know that veterans are living disproportionately in rural areas, and rural communities are already facing barriers to care. So there's a double impact there. The other piece I want to point out with these dashboard is while the data aren't available from MEPS, which is the Medical Expenditure Panel Survey on a state level, they can be evaluated by region, so you can get a sort of proxy for state level data through this dashboard here. This is another screenshot of the dashboard and what you can look at. When you click on the rural tab, it takes you to this interactive dashboard on rural veterans. And across each indicator, it's really clear to see that rural veterans delay dental care due to cost, spend more out of pocket on dental care, and struggle to find accessible locations for dental care. And this is all veterans. It's just veterans versus rural veterans looking at this piece here. Rural veterans also feel more impact from lack of access and utilization of dental care, often citing that the state of their mouth or teeth is embarrassing compared to non-rural veterans. I think we saw that reflected in the quote that I shared earlier. And rural veterans also struggle more with a functional dentition, which likely leads to the data points we see around increased cost of care, as well as the higher emergency department use. Okay. This is looking, again, all of our publications on veteran oral health are available on vetdentaldata.org. And I want to invite you to, if you haven't already taken a look at your state profile, we are going to dive into that in just a second. We invite you to go to vetdentaldata.org. You can hover over North Dakota, or you can go to publications and put in North Dakota and pull up your state profile and follow along as we look at that in more depth. Okay, so like I said, we are going to dive into your state, the real reason that we're all here. Before we do so, we're going to toggle back to Slido. And I would love if you would share in one word naming what you think your state's biggest challenge is for veteran oral health. So again, if you closed out your window, you can scan this QR code. You can go to slido.com with this code here. Cost. I see that several participants have put cost in here, access, rurality, and all of those pieces tie into that access point. They're all connected to access, right? And I also, circling back to that connection piece, if there are folks here who maybe you're working in rural communities in your state but aren't working with veterans, I would love for you to share that to make some connection pieces for folks. We're going to talk about partnerships and non-traditional partnerships in a minute here, but access to providers. And if you want to put in the chat too, the other thing I wonder about access to providers, is that insurance cost piece, or is it a workforce piece where there is a lack of providers? Okay, I see that folks are still participating. I'm going to go back to our slide, but please still keep filling this out. We want to hear from you, and we save all of these pieces and share them out afterwards. Okay. All right. So I'm just going to double tap back on the piece that this seminar is just as much about us listening and learning from you. You know North Dakota best, your data, your context, your communities. Your insights help us improve these profiles and make sure that the tools we're producing are useful in your efforts to support veteran oral health. So please feel free to share as we've gone along. Also noting that we've done our best with the data that's available. And while it's limited, we'll talk about that a little bit and opportunities for additional data gathering. We really wanted to take our findings and put them in a visually appealing, clear, and easy format to understand. Okay, so let's go through the profiles and look at what we are seeing. We open each profile with some quick context. What's happening in North Dakota, how it fits into the bigger picture nationally, especially when it comes to dental care access through the VA. So again, the same as we started this seminar, the point that we always include is that most veterans are not eligible for dental care through the VA. I've been doing this work for many years now. I'm not sure that I said, but I am the spouse of an active duty service member, and I am still surprised that folks are more often than not surprised that veterans are not eligible for dental care through the VA. It's an assumption that folks make that if they're getting health care, they must be getting dental care as well. That can be a really powerful place to start your conversation, especially when you're bringing this to policymakers, funders, decision makers who don't realize that need. Okay. So we've also included data on where veterans live. I saw folks put rural as a North Dakota piece in here. Okay, lack of providers. Okay, great. So looking at that rurality piece and understanding where veterans are living in your state is really important. You'll see the highlight here of the counties that have the highest veteran population in your state. And then you can also look at a map that dials in across the state with those percentages. I think something that can be really useful is to look at this in comparison to where VA clinics are located in your state, specifically VA clinics that have dental clinics within them, because not all VA clinics have that. So that can give a really quick understanding of maybe where work needs to start. Looking at this part of the profile, we compare North Dakota to national averages because without that context, the numbers really don't mean much, right? So if you're sharing this out with someone, a decision maker, a policy maker, they might not know, is 12% high? Is it low? Is it somewhere in between? So including that national average helps you quickly see where North Dakota stands. And the other thing I like to point out is that you can compare across states if that's helpful. You can pull up another state profile. You probably know best what state is similar to you, whether it's their population, whether it's their rural communities, whether it's the political environment, if you're considering legislative options. Maybe you have a colleague and you know they have a success story, so looking at their state. Doing that comparison, we'll also look at some screenshots of ways you can do a fast across the entire country comparison with the dashboards. Okay, earlier we talked about chronic disease, those high cost, high risk conditions like heart disease and diabetes that are closely connected to oral health. Because those connections came through so strongly in our research, we wanted to make it easy for you to highlight them when you're talking to decision makers, planning your programming, figuring out where the best place to start addressing this population need is. So in this section, you'll find data on heart disease, diabetes, insurance status, and indenturism, all compared to national figures. We also then ranked each state across those 4 key outcomes, so you'll see where North Dakota falls compared to the 50 states. So looking here, okay, and understanding that number 1 on these pieces is the worst. So we're doing better in these areas. Okay. If you are interested in how we did these rankings, these numbers, the technical details of this research, there's a full methodology posted on vetdentaldata.org. Okay, so this is our overall grade again. Looking at these higher numbers is actually really great, and we see that reflected here when we look at the overall grade. We chose a report card style purposefully for, again, this to be a tool that you can take to lay people who might not be in oral health, who might not be data analysts, to have a really quick understanding of where your state stands. Most folks have gotten a report card in their lifetime and understand, okay, I have a C and this is where I need to do some work, and I have an A and that's where I know I'm doing well. So again, you'll see them given individually for diabetes, rates of uninsured, and dental visits. The percentage of veterans in North Dakota that visit a dentist in the past year. Then we combine all of those for the overall grade. A point that I always like to make with this section of the state profiles is to really take some time if you're working with your team, if you're working with your coalition and really thinking through strategically, okay, we know that there's a population need with veterans, but where do we start? One thing that I like to recommend is not only looking at maybe that C grade and saying this is a place where we need improvement, but looking at that A grade and thinking through, how did we get that A? What strategies were implemented before that have gotten us to that successful place? Maybe there's some success stories and lessons learned that you can implement when you're looking at those other areas to improve. Same comment if you're looking at states comparatively, neighboring states, states that are similar to yours, if they have a higher grade, it might be worth finding colleagues or reaching out and seeing what successful models got them there. Okay. Again, this is going back to the dashboard. It allows you to quickly gain insights on key indicators, comparing other states, so you can hover over and find across the states comparisons, really giving you an opportunity to quickly gather comparable data, and then you can dive into that state profile to look at it more in depth. Okay. So we've used Slido. I would love for you to toggle over to chat. We talked about the fact that data is limited. Our research had qualitative pieces, but for the data pieces, we were really pulling publicly available data sets and doing an analysis. And we know, of course, there's limitations to that. So we would love to hear from you. Is there a barrier that you see in your work in your state that isn't reflected in the data we just looked at? Is there something you're coming across that wasn't um, shown here looking at the data? Or it might be a recommendation for a place that you think we need to look into more. And Rahel, I'm going to try to pull up my chat, but it might block. Okay, over here. So feel free. Okay. All right. I'm going to go over to our next slides, but Rahel, if folks are chiming in the chat with this, you'll interrupt me, right? Okay, fantastic. I like to be interrupted, y'all, so please chime in. All right. So we've looked at what your state profile looks like. And again, our goal is for this to be a usable tool. So we're going to talk about some ideas of ways that you can use this information. Again, it was designed in a purposefully visually appealing way so that you can use it. I hope that those details were informative. If you'd like to put in the chat, if anything was new or surprising, I would love to hear that. Um, Again, we want to leave you feeling activated and like you have steps forward. So we're going to talk about using the data to illustrate the need, sharing the profile to start conversations, and taking action to elevate success stories. So what does that look like? One of the most powerful things that we can do with this data is to advocate. And that looks different depending on your role. Maybe you're a provider, a policymaker, maybe you're a veteran yourself. This profile gives you credible local data to bring to your city council, to your boss if you want to start a new program. Maybe it's your board for the nonprofit that you're on and you want to start a nonprofit new program. Excuse me. This really gives you a piece to start the conversation. You could also do something like organize a listening session in your community. Maybe you invite decision makers or you invite veterans themselves to speak to their experience with oral health. I also want to point out that small advocacy actions really make a big ripple effect. It doesn't always have to be going to the Hill and having a Hill Day in DC or an advocacy day at your state capitol. It can be those small everyday things of starting a conversation. That's advocacy, and those make a big impact, especially when it's building awareness around the population need. Okay. So again, to that end, many people working in healthcare don't know how stark the oral health gap is. And that's where education comes in. So you could use this profile to lead a short talk at your organization's staff meeting, debriefing a coalition to a partner organization. I mentioned non-traditional partnerships. This is a piece where you could cross-pollinate, or maybe you volunteer on a board of an organization that's outside of oral health but connected to public health, and you want to bring forward this population need to them. When stakeholders are informed, they become allies, and that's really how we build momentum around a need. And again, it's an opportunity to collaborate across silos. So you could bring this to someone in housing, in mental health, food access, really looking for those ways to align your efforts. Okay. This data is a tool for strategic thinking. We kind of touched upon briefly looking at the areas and figuring out where do we focus? Where do we start? We understand there's a need. What do we do? So it might be an actual where. So it might be a certain county that has the highest concentration of veterans, or it might be an area focus, right? So looking at that grade and picking an area to focus in based on that report card piece. We hope that these tools help you make the case for why you're investing resources where you are. And if you're doing an evaluation, reporting, all of those pieces that are so important to showing our work in public health. It gives you a baseline. Here's where we started. Here's where we're trying to shift to. And to that end, we want to talk about how we can bring in resources for that work that is so important. So grant makers and funders, they want to see data and they want to see it grounded in the community. And our hope is that this profile gives you a start for that. So again, you can use it as the problem statement, the why of your grant if you're writing out a grant request, showing the gaps in care. You can again cite it as a foundation for what your solution will address. Use it as a benchmark for that pre and post testing piece, really allowing you to measure outcomes and deliverables on your program. Okay, I am going to stop my slides for a quick second. Well, actually, sorry, no, I take that back. I'm gonna pop us back over to a poll and then we can do some Q&A. So sorry for the quick change. If you don't have it up, if you could go over to Slido, we're gonna do another poll. And we would love to hear from you. Which of the following resources would you most use in your work with veteran oral health? Again, we are in the research space, and our goal is for that research to be translational. We are not doing it for research sake. Our goal is to make tools for the community that is helpful to them. Policy briefs. Okay, great. If folks have specific ideas on policy areas and the type of advocacy that they're doing, that would be helpful. I would love to hear that in the chat. Educational materials. Same with the educational materials, that comes up a lot. Oral health literacy comes up a lot in these seminars, educational materials, and I find that every group has a little bit of a different thought around the educational materials. If you wanted to share the target for that, sometimes it's the veterans themselves, sometimes it's clinicians, sometimes it's those care coordinators understanding what resources exist in your state where if they're the folks who are helping veterans access care. So if anyone has additional thoughts on those pieces, I would love to hear them in the chat. Okay. So I said at the beginning, we're going to talk about some state-based examples of what successful models look like at the state-based level. We understand that to access care through the VA, legislation needs to change at the federal level. But there have been many states who are successful implementing programs to help their veterans access care. We share these because they're all very different models in states that are very different from each other, both in region, in population, in political landscape. And these states were able to find successful legislative pathways that worked for their state and their populations. So Florida, they passed this legislation. I don't know the exact date, but it was recent, and the program just went into implementation this spring. So they passed legislation creating the Veterans Dental Care Grant Program within Florida Department of Veterans Affairs. And the program is designed to provide dental care to veterans living in Florida. The department partners with statewide direct support organization to administer the program. And then that organization distributes grants to nonprofits with a strong track record of serving veterans. And those nonprofits deliver the care to eligible veterans based on income, service history, and other qualifying criteria. So it's a grant making organization. There's a structure to how those grants are made. And then again, it was newly implemented, so we're keeping an eye on Florida. From what we have heard thus far, it sounds like it's successful so far, and it has been approved for additional program length. So that's a really innovative approach and really interesting to look at how that was passed and how it's going. Oregon developed an innovative Medicaid carve-out specifically for veterans who don't qualify for VA, dental benefits, or traditional Medicaid. So veterans are first screened to determine if they qualify for either of them. And then if not, they're enrolled in a local coordinated care organization and receive free dental care through a network of community clinics participating in the program. So a very different model, but also again, connecting organizations at that state level. Iowa, the state uses lottery dollars to fund the Veterans Trust Fund. That fund provides direct grants to veterans to help cover out of pocket health expenses, including dental care. I will talk about Iowa a little bit more here because we have had the privilege of doing several years of work in the community at this point. We started, our research team did a year-long research analysis of what veteran oral health looked like in the state and published a 70 some odd page paper on veteran oral health in Iowa. We published that, not just the findings, but with strategic recommendations. And then over the course of the past couple of years, we've been able to go into Iowa and work with the stakeholders to really dial into those strategic recommendations, understand from the stakeholders themselves what are the most viable, publish a strategic report, and facilitate the coalition um, going forward with those strategies, particularly around advocacy and expanding that trust fund that has been such a successful model. So we're thrilled with our work with Iowa. And I point this out if you are thinking through our state is poised to do more work, or you want to look at the model of the trust fund or what stakeholders are saying in depth in a state. All of this data and all of these reports are also available on vetdentaldata.org, and we are happy to answer questions. These are just the recommendations. And I'm going to look, I see that Kim's sharing that educational materials for medical providers and public health would be beneficial. I'm going to extrapolate Kim a little bit that I'm hearing from that, maybe some medical dental integration pieces. And getting the medical provider side on board with that integrated care. Okay, I'm also looking. Um, I don't want to put you on the spot, Kim, but would you be willing to share?
About the medical providers and public health?
Yes, well, I was also looking at your policy examples piece. And so I'm
Yeah,
thinking,
so yeah, so I actually selected the policy briefs in the Slido, but as I'm thinking about who we can share the state report card with, we have a oral health study that was selected by our state legislature that involves it's going to be more focused on Medicaid access, but there's a component for kind of looking at access for individuals with disabilities. And so I think that this profile would be a really great thing to share with that committee, and a few lawmakers who I know are very dedicated to veterans, and veterans oral health might be a component that they maybe haven't really thought that much about, and some of the policy examples.
that's really awesome. I'm glad to hear that you're so poised to share out and have the conversation started. I will also share that outside of our veteran work, again, we have 4 communities of focus. We do a variety of research across those communities of focus. And a project that we worked on about a year ago was on people with disabilities and developing out an advocacy toolkit for Medicaid dental benefits that could be used across states. And so if that's something you haven't seen, we can pull the link and send that out. And if you're kind of having those discussions and building coalition around that, some of the lessons learned and pieces shared might be really helpful. We did that in partnership with Texans with Disabilities. who are longstanding successful advocates in that space, and they really shared out success stories from Texas of ways that they were able to improve access to dental care benefits. And part of our piece was if they could accomplish that in Texas, other states can certainly take some lessons learned there and replicate some success. So we'll share that resource if you haven't already seen it.
That would be great.
Yeah. Okay. I am going to, now I actually really am going to stop sharing my screen and see if there are questions that we can answer for folks before we go into our next steps. And I'll just do a quick check. I don't think I missed anything in the chat, Rahel, but is there anything you're seeing there?
I think the one question I had been thinking about, you kind of answered towards the end of your slide. I was interested in what other states are doing policy-wise at the state level. Do you guys have someplace where you kind of have a list of what other states are actively doing or have passed, or is that just something you have individual examples of?
That's a great question. Um, so we don't have like a deep researched every state in the country. This is what's currently happening on the ground. Um, but I part of the work with this seminar that we're doing is putting together a report on a compendium report of all of the states. And that includes us looking at the feedback that we've heard from participants and the discussion that we've had on those sessions, people sharing out the work that they're doing, just like you did, to pull together those summaries for each state. Our goal is to have this seminar in every state in the country. We are well over half at this point. So I think we are on target to publish that initial report October, November, we will have on the website as part of our veteran oral health resources, excuse me. And then since we will still be visiting states with this seminar, it will be a live document that we continue to update with summaries and pull out from states. There's also some, this isn't veteran specific, but I would also point to our partners at NRHA, which is National Rural Health Association. You might already be sitting in on their grassroots calls, but they're doing a lot of work, again, rural specific, but we know that touches on veterans, of really looking at monitoring each state and pulling out legislation that's happening in each state and pulling out red flags that might be happening in when states are facing losing access to care in those rural communities. So I would point to them as a resource for kind of looking at a dialed in of what's happening at the state level for those communities. Okay. If other pieces occur to folks, I invite you to put it in the chat or interrupt me. I will pull back our slides to talk about next steps, but I'm happy to continue to answer questions if there are pieces that occur to folks. Okay. So I hope that this is leaving you feeling activated. I hope folks are leaving feeling like they have learned something. I know it's also a lot of information to take in. I talked for a long time about a lot of specific data. We're all very busy, and so even if you're feeling activated, sometimes it can be hard to move forward. So I'm going to leave you with one concrete, easy step to take after the session to keep the momentum from our time here today, and that's to share the state profile with one new person or organization. If you are willing, I would love it if you would post in the chat who you're going to share that with. Then we can keep each other engaged and accountable, and love to hear who you are thinking about for that piece. Okay. For next steps for logistics, I mentioned at the top of the call that CEU is available for today's session. Rahel is going to pop that link in the chat. Our CEUs are hosted on our Academy. the link that you will follow for that Rahel just posted will take you up to our VRT page, and you will see past recordings. You scroll down to your state, and you will find the form to fill out. It's an evaluation and a request form, and that will automatically populate your CEU after you complete that form. We will also be posting recordings and resources from today's session to the Academy, that same page. And we'll share that out via email when those resources are posted. If you have colleagues or peers that you think would benefit from this session, we welcome you to share it out with them. Again, they can watch asynchronously. They can obtain their CEU asynchronously. So please share widely with your colleagues. Um, Another piece, I mentioned our mixed methods approach to our research. It is always very important to us to be raising the community's voice when we are doing our work, sharing out veteran stories and leading from behind. We are working on collecting veteran stories about their experience with accessing oral health. It's a really important part of our research and our advocacy. So Rahel's going to pop a link in the chat that is our veteran storytelling form. It is a simple form to fill out. If you yourself are a veteran or you know a veteran and are willing to share that form, it's a way that they can share their stories, and it's completely anonymous, so that we can bring those forward in our advocacy work. Okay. I will pause one more time and see if there's any questions that folks have before we finish up. Okay. I leave you with Veterans Deserve Equitable Oral Health. And a big thank you for being part of this conversation and taking time out of your day so that you can be here and understand what veteran oral health looks like in your state and being part of that. Okay. Okay, I see all of these. Great. I'm so glad you have so many folks that you're planning on sharing with. I hope everyone has a wonderful day. We're here to answer questions. Please feel free to follow up with email, and we'll see you all later. Bye-bye.